So the Medical Research Council is deeply committed to funding research in the 10 most causes of mortality, of which TB is one of the highest. And because of that, there's a huge funding commitment to fund TB work, from basic discovery to implementation science to evaluating the social context in which TB happens. We fund laboratory work, we fund diagnostics, we're looking at ways of supporting drug discovery. So we need to be able to diagnose TB at the bedside, in the community and at the clinic. And we need to be able to diagnose TB whether you are an old person, a young baby or an adolescent. And so the first thing we need to be able to do is diagnose TB in an easy and cheap way. Once we've diagnosed TB and in an easy and simple, cheap way, people need to go onto treatment. And the treatment that people need to be on are treatment that have no side effects and you can adhere to for prolonged periods of time. And so we have a problem with poor diagnostics, lack of diagnostics in the field, and a problem of keeping people on treatment because the treatment is horrible and causes lots of side effects. TB is a huge problem in South Africa, not only at a community level, but our healthcare workers, nurses and doctors are susceptible to TB as they manage people with TB in their wards. We have medical students and student nurses that also get exposed to TB as they look after patients, and so we also have to make sure that our healthcare workers are looked after and managed adequately in terms of TB. Why do some populations get TB more than others? Why are some people resilient to TB despite a large amount of exposure? And so the Medical Research Council is interested in understanding what are the genetic factors that predict TB infection or make you resilient. Because if we knew what made you resilient to TB, we could make a vaccine or a drug. And if we knew what made you more susceptible, we could develop a diagnostic test, a genetic test that will help you understand your vulnerability to TB. We also understand that you need to look at the environment in which people live, and environmental pollution, household pollution, smoking, all of that affects lung function and susceptibility to TB. And so you cannot be committed to TB without addressing issues that happen in the environment. We view partnership as very important, and so we work with everyone from the National Institute of Health to the Gates Foundation to the British Medical Research Council to the Newton Fund to Grand Challenges to other institutions in France, Sweden, other international areas. And so the South African Medical Research Council works with many people, many funders, many countries to try and address the problem of TB. The Medical Research Council is working with the TB BRICS network. So there is a network brought together through between Brazil, Russia, India, China and South Africa. And we're working with those scientists to address the problems of TB in these countries. And so the TB BRICS initiative is an endeavor to try and raise money to find local solutions for our problems. We also work with WHO in highlighting the importance of TB and highlighting the lack of adequate resources at a global level for TB research. So TB is a devastating disease, and it causes lots of pain and death. And if we wanted to find a South Africa, or if we wanted to work towards a South Africa that was free of TB or could cure TB and treat it properly, we would want to invest in research that made diagnosing TB easy, made the drugs that we use simple without side effects, and also had a vaccine that could protect against TB for lifelong. And so you cannot there is not one single part of funding TB that is better than the others. Imagine if we could diagnose TB, we could treat it. Imagine if we could treat TB properly and get cured, and imagine if we could prevent it. And so for me, preventing TB is as important as diagnosing and treating it properly, and we can't do one without the other. It would be foolish not to try and fund all aspects of TB. If our whole endeavour, if the South African Medical Research Council and the South Africans' vision or dream of not having TB is true, we have to fund everything that addresses that problem to try and eradicate TB.